In a provocative new op-ed, Deepak Chopra claims that when it comes to health care reform, President Obama is Daniel in the lion's den. The renowned doctor warns that reform is under attack by greedy special interest. America needs to know about it. He's joining us from San Diego to explain. Welcome to you. Good to see you.
It's good to see you, Campbell.
You are calling, I know, for a public awareness campaign to try to sell people on the need for health care reform in this country. But, you know, President Obama has been out there talking about this every day for weeks now. You don't think he's getting the job done?
I think President Obama is doing a great job, but there are special interest groups who are taking the attention away from the facts. The facts are that we spend $2.4 trillion, more than any other country in the world, on health care. We rank 32 in health performance. We rank 72 in health levels. We spend $6 billion on advertising, $1.4 million a day on lobbyists in Washington trying to influence people in government who we have elected to work against us. Sarah Palin and Senator Grassley, when they talk about death panels, they are fear-mongering. I think people should be aware that most of the interventions at the end of life do not prolong life. They prolong suffering. They wreak unlimited, untold suffering and carnage on our people while benefiting special interest groups to the tune of billions of dollars. There's something drastically wrong with our healthcare system, and unless we become aware that, 90% of the healthcare dollars that are spent are on preventive illnesses.
So explain this to me, because I want to get into the specifics here. You recently wrote that we need a healthcare system that reduces fear as well as cost. What do you mean by that?
Well, our healthcare industry is the only industry that creates a demand when there is no need to create a demand. Capitalism is built on a supply-demand theory, but we doctors have the privilege of generating our own demand by writing a prescription or writing a procedure. The most devastating and expensive healthcare technology is a physician's pen and a prescription pad. 80% of the drugs we use are of optional or marginal benefit. We spend $700 billion a year on unnecessary tests. The next time you go to a doctor for a routine examination, there's a 43% chance that you will be prescribed an unnecessary diagnostic procedure or a test. We spend 2.5 million unnecessary surgeries a year. Hysterectomies, spinal fusions, knee operations, cabbage, angioplasty, which do nothing to help the patient. So unless we are honest enough to look at our own self and how we are generating this demand, we could be saving $1 trillion a year.
But how much is also the individual's responsibility, taking responsibility for your own wellness? I know you've talked about this as well.
Well, it's very important, Campbell, but the individual has to be aware. We have to create a public awareness campaign, which is the only missing part. If people would realize that they could prevent 80 to 90% of chronic illness just by doing 3 things: exercise, diet, and stress management, and you would upregulate the genes that are responsible for cancer, for heart disease, for inflammation. We know that the human body is not a structure, it's a process. And if we understand the process, we can influence the outcome of illness and prevent much of this illness at no cost whatsoever, just by being more aware.
Individual responsibility. Deepak Chopra making his case tonight. Thank you so much for your time. Appreciate it.
Thank you.